We want to, on behalf of the panel, say thank you to SBA and the community for recognizing this important topic. We are very excited to be here tonight. We want to also acknowledge there is very limited literature out there that is specific to spina bifida and obesity or weight management. And so we are excited that we can have more advocacy for this area. As you will see here, we could talk about this for a long time, but we're going to condense it down to 1 hour. And we're going to cover an overview of weight management. We're going to talk about nutrition, activity, and some current research. And then as noted, we do have 2 sessions in February that we're excited to go over questions and answers with you. I know you already have this, and I want to point out the importance of this. SBA in 2018 published guidelines, and they published 25 of them, and they are on the SBA website. And I believe you have a link for this specific one because it's related to nutrition, metabolic syndrome, and obesity. And it is a great resource, so I highly encourage everyone to review it. This slide here is just to talk a little bit more in depth about the prevalence of obesity in US adults. And this was done in 2022. And I think the important point of this, it's more to show that we do have an issue. And I think we're all here because we know that there's an issue with obesity prevalence in our country, and it has only increased over the last 30 years. So it is a way to represent it visually. What's important about this slide is that it is showing us obesity and not overweight and obesity. So it would be even higher if we combined it with overweight also. Another important point on this slide is that you see variability in the colors by geographic regions or by states. And that's what's interesting about obesity is there's a lot of variability, even not only where you live, but also some internal or individual characteristics that we'll talk about. So the prevalence. Like I mentioned, we do not have a lot of specific information just for spina bifida, but we do have good information in the overall population. And it's almost right now, about 3/4 of our adults are considered to meet the criteria for overweight or obesity. Of those that are considered obese, there's a subset that would actually meet the criteria to be considered severely obese. And that's a concern because we already have a problem with obesity. We don't want people getting heavier. As noted, we do not have specific numbers related to spina bifida, but it's estimated up to 64% could be considered to meet the criteria for obesity. When we look at children and adolescents, the numbers are still concerning. A little over 1/3 of our children and adolescents are considered overweight or obese. Similarly, with their obese category, we do have a subset that are meeting severe obesity guidelines. Now, again, we do not have specifics related to spina bifida and children and adolescents, but we do have a study that we can talk about that our team did. It was published last year. And what it did is it looked at children and adolescents who participated in the National Spina Bifida Patient Registry from 2009 to 2018. So over 7,000 individuals. And of those individuals, almost 50% met the criteria for overweight or obese, and non-myelomeningocele, about 1/3 were considered overweight or obese. So we know that there is a problem. The numbers are not as specific for all because these numbers here even don't represent all of the population of spina bifida. They only represent those that were involved in those clinics. So it's helpful, it provides insight, but it's not the end-all number. We want to be very clear tonight because I think when we talk about weight, it's a very inflammatory concern. It really creates a lot of emotions, and we want to make sure that we're all under the same guiding principles for our talk. First of all, we know that weight management is not easy. It's very complex, and the reasons that it's caused are multifactorial. If it was easy, we wouldn't be in the predicament that we are in. We also want to acknowledge that weight management is very individual, and what works for one person may not work for another person. In addition, we know that obesity that is initiating in childhood will often continue or worsen as the child moves into adulthood. So it's really critical that we start early on these talks. Prevention is always preferred over treatment just because it's a little bit easier. Once the weight is on, it's harder to get off. That being said, we want to note carrying excess body fat does not automatically infer that someone has poor health, but the evidence is very clear that carrying excess body fat is associated with poor health conditions or secondary comorbidities. So it is a critical priority topic. And last, we are not talking about losing weight or optimizing weight for appearance. We are really promoting health. When you look at obesity coupled with the diagnosis of spina bifida, we do know that individuals with spina bifida are at the same risk for obesity-related comorbidities as typically developing peers. We also know that obesity will present a greater risk for muscle loss, pressure sores, depression, surgical complications, and decreased participation in physical activity and socialization. Finally, and most importantly, having obesity with spina bifida can hinder the individual's ability to reach their highest potential for independence. It may increase the need for assistance with transfers, ambulation, self-care, and activities of daily living. And that is our priority, and that is what's driving this talk and needing further work in this area. So when we talk about weight categories, what we really want is not to know so much about what someone's weight is, but we would want to know body composition. And what body composition is it's looking at the ratio of fat mass to fat-free mass for the individual. And if you think about that for just a moment, everything that is not fat, so bones, organs, muscle, tissue, etc., that's all fat-free mass. We want to know what that ratio is from the fat to the fat-free mass. In addition, in the perfect world, we want to know where that body fat is located. We know that excess body fat around the abdominal region puts us more at risk for those secondary comorbidities. So when you've ever heard about apple shapes versus pear shape, that's what it's referring to. So our goal is that we would like to be able to assess someone's body composition and the placement or distribution of their body fat. We would like to be able to do this consistently and repeatedly over time so we can monitor trends so we know when to intervene. We also, to do this consistently, want to do it in a clinical setting. And to do that, we need to have something that is cost-effective, easy, and expeditious to do. So it's a big ask, and currently, we don't have a great answer. What we do have is a body mass index. If you're familiar with that, it's often referred to as BMI. It's a very simple math calculation that takes into account someone's weight in kilograms divided by their height in meters square. As time has progressed, all of our electronic health system charts will do this automatically for us, or you can do it online by yourself with your own weight and your height. In adults, what will happen is that BMI calculation produces a number. And let's say the number is 27. That number will align with a table that gives us categories of weight. So a 27 would be in the category of 25 to 29.9, and would have that person be considered meeting the criteria for overweight. In children, it's a little bit different because children are growing. So that number of 27 would have to be plotted on a graph that would be specific for that child's age and sex. And what that does is it turns it into a percentile, and there's a few extra steps involved, but it still allows a category or weight status to be put on that person. Now, I think you maybe have heard there's some problems with BMI. No one loves the BMI. So that being said, I'm going to say we agree. It is not a perfect tool. One of the biggest concerns that we have with the BMI is because it takes into account weight and height, it does not differentiate muscle mass. And you might have heard the criticism that if you had an athlete that was highly muscular, they may look like they're overweight or obese based on a BMI because their weight is higher, but it's muscle mass. So when using a BMI, it's really critical that you use a little bit of common sense with it. The numbers are just giving a proxy for a body fat, and they are not, we know that they're not specific or 100% accurate. Now, the same issue can happen. If someone has too much muscle mass, it can be inaccurate. But if someone has too little muscle mass, that BMI also can be inaccurate. The major con, it is created based on norms of the general population. And as an individual with spina bifida, that would be a major concern because it's not apples to apples. Another concern, you can tell from the calculation being height and weight that there's a high reliance on the height measurement. Two concerns with that. Number one, we know that there are individuals with spina bifida that have shorter stature. So using their height is not going to be as comparable to the general population. In addition, we also know that there is sometimes are inaccuracies when how the height is measured in a clinical setting. So it's really critical that that height is done in a standardized fashion and it's done consistently. Now, I've pointed out all of these negatives, and you're going to say, why do we even use a BMI? Well, quite honestly, it is not perfect, and if used with some common sense, we can use it for a purpose of monitoring trends. If we do it consistently and as accurately as possible over time, we can start to see trends emerge. And if there's a huge shift or uptick, that can be a concern, or vice versa if there was a huge change for the less. So it's a talking tool that allows you and your healthcare provider to monitor and to have that conversation. Last thing I will say about this is with height measurements, we know that if an individual is not able to stand safely, there are alternate height measurements that can be done. And most commonly, you're going to use an arm span, but they also sometimes will use recumbent height or other heights. This slide is very busy, but it has a lot of important information on it. The take-home message of this slide is that obesity is the one diagnosis that is so scary because if you think about your body, it's broken up into systems. And if you want to call it cardiovascular system, endocrine system, respiratory system, and so forth. Obesity is the one diagnosis that has the ability to affect negatively almost every system in the body. So that is a major reason that we want to prevent obesity from happening in the first place. I did highlight 2 of these circles in red. I think for the whole population, it's a very big concern that we're becoming more aware of how weight can be not only stigmatizing, but it can lead to some mental health concerns or contribute to mental health concerns like depression, social isolation, anxiety, and low self-esteem. In addition, from a very major priority for spina bifida, it affects the skin. It will affect and cause poor wound healing, pressure sore risk, soft tissue infection. So another reason to place this at a high priority of concern. So how does overweight or obesity occur? Well, I think we have heard it's too much going in and not enough going out, or there's an imbalance between intake and output. Talk about this a little bit more because that is very oversimplified. We want to recognize that that's oversimplified. Every day, energy intake and we have energy expenditure occurring in our body. The energy intake is calories consumed. Not as simple as it sounds because not every calorie is equal. There are different qualities for calories consumed. So important on what you're eating. But in general, calories consumed go in, and then we expend our calories through energy expenditure. Energy expenditure is made up of a few different components. First of all, we have our resting energy expenditure, and that is about up to 60, 65, or even 70% of our energy expenditure is based on resting energy expenditure, and that is just the basic needs that our body has to function. So breathing, circulation, it takes a large amount of our energy expenditure. Physical activity is the next largest component, and that could be about 25% of our energy expenditure, sometimes a little higher, and that is made up of 2 components. It's purposeful exercise and general physical activity. So if you think about that, we can make a choice to do purposeful exercise, and that might be wheeling or walking around the block or going to the gym. But in addition, if you think about your day, you're doing activity all day long, or hopefully doing some form of activity. So if you park further away from the grocery store, or you have a job that requires you to move more than sitting sedentary, that's general activity. So those 2 combined will be another component of energy expenditure. Finally, the act of digestion is about 10% of our energy expenditure every day. So that includes everything from chewing down to absorbing nutrients to expelling. And that whole act of digestion, like I said, about 10% of our energy expenditure. For our children, they are growing, and that is another piece of energy expenditure, a very small component. And we do not have that luxury as adults anymore, so we lose that energy expenditure. Factors that can affect energy expenditure can be age, sex, activity level, body weight, muscle mass, many different factors, some controllable, some are not. When we talked about how complex obesity or weight management is, it's really because it's not just based on the individual. This is a great model called the socio-ecological model, and it can show you visually how complex this can be. If you look at this model, it's really showing that there's interconnected relationship between systems. So the individual is always interconnecting with their interpersonal life, organizations, community, and then the government part, or the regulations or policies. All of those will play a role and interact with each other and create unique circumstances for that individual. In this situation, we can outline how that relates to obesity or weight management. So from an individual level, race, genetics, gender, age, level of lesion, mobility, all play a role. Your interpersonal level is your household. If you think about that, your environment that you have created, your family, your spouse, significant other, your peers that you are with, role modeling that is either done for you with your peers or as children, parents are great role models. Then you have your organizational level. Most of us are outside of our homes and we're doing school or work every day. Does that school life promote activity? Is there opportunities for activity or FAAN class? Does that work life promote sedentary activity or physical activity? The community we live in, is it wheelchair accessible, safe, walkable? Are there access to food? It's called a food desert when you don't have close by local fresh fruit options. And then you have the government regulations, laws, and policies that affect us on a daily basis without us even thinking about it. So back to the individual. We know that genetics play a huge role, and we can thank our parents or curse our parents for that. We also know that the individual characteristics, level of lesion, demographics, mobility will play a large role. Hormones. We are starting to hear more and more about hormones, with oftentimes talking now lately about medications. There are many hormones that will influence our fullness or our hunger. And some of those that we hear about, insulin, ghrelin, leptin, GLP-1. Behaviors. What we do every day. When we wake up in the morning, do you look at your phone first or do you get up and move? There's a choice in everything that we do throughout the day, and those are all behaviors that we have control over. And oftentimes when we're thinking about weight, we're thinking about activity and nutrition behaviors. Our culture that we grew up in or the culture that we live in does definitely affect our weight and weight management. And then the environment. Foods available. Are we supporting physical or sedentary activity? We are talked about to have an obesogenic environment. And what that means is our society really promotes excess weight. If you think about that, just a few examples, fast food restaurants are everywhere. Portion sizes are extremely large or more than what we need or have grown over the years. Technology has automated so many things that we do not need to move as much as we used to. Packaging of products. It's really hard to tell when someone is saying that Lucky Charms are healthy when we know that they're really not. But it's very hard because the packaging is very, very challenging to see through. So treatment options. Lifestyle, medication, surgery. Those are really the three mainstay of treatment options. And not all of these are available for everyone for many different reasons. The point I want to make first and foremost, lifestyle. Lifestyle is the foundation behind weight management and overall good health. The behaviors that we have control over are so critical. So what we can do on a daily basis related to our activity and our nutritional intake, quantity and quality are important. The environment that we set up for ourselves are very critical also. And even if there were an option for medication or surgery, lifestyle is going to be used in conjunction with those options. Medications, we have heard a plethora of information lately as there's new medications coming out for weight management, and there's many different options. I predict that we will continue hearing more options as it's obviously a moneymaker, and we are learning more about how these medications can be useful when they're combined with lifestyle change. There are many side effects to be noted, and specifically a lot of GI side effects. There's a large amount of cost at this point, and we really don't know the long-term outcomes. This is just being initiated, and it's been picked up by the media, but we do not have long-term studies, nor do we have studies related to Spina Bifida and the newer medications like the GLP-1s that are being talked about. And medications are beyond GLP-1. There's also medications from back in the previous times of just amphetamines or different other medications. So there is a spectrum of options available. Surgery. Bariatric surgery has been around for quite a while and has advanced throughout the years. Some of that is not as invasive as it used to be. Essentially, there has been proven benefits of having bariatric surgery for a subset of people. Again, this may not be something that is even available for everyone, but it is an option out there for some. And the negative complications, expensive and also requiring ongoing changes are something to be noted. So at this point, I am going to turn it over to Dr. JoAnne Whelan to talk about nutrition. Thank you.
So in this section, we're going to be covering nutrition recommendations and goals throughout each developmental stage, beginning here with infancy through adulthood. And it was really fantastic that Dr. Polfuss added in the research article at the beginning of the talk that helps highlight the nutrition and work group put together. And a lot of these guidelines will be covered throughout this segment to refer back to as well. So this emphasis again is on healthy eating and nutrition for a general healthy lifestyle. Again, this not necessarily looking at it from a total appearance state for weight management, but it's essential to kind of start here in infancy to see how things change and progress and how we develop those habits early on and then throughout as we get into adulthood. To begin, the American Academy of Pediatrics recommends exclusive breastfeeding for at least the first 6 months of life. And we know this can certainly be challenging for any infant, but even those with spina bifida. And this might be related to multiple factors. So maybe there's interruptions for surgeries or medical procedures. You know, maybe we're having the infant learn to suck, swallow, and breathe. And so managing all that can be challenging as we're trying to progress with growth early on. So infant formulas can certainly be added at this time. And then a lot of times we might even have to consider what is happening with the growth and if we need to add higher caloric concentrations and different levels of calorie delivery if that's necessary to achieve desired growth. As the child ages, we're going to definitely be thinking then about adding solid foods. And the complementary solid foods is necessary to meet increased iron and possibly more protein needs depending on the amounts of breast milk or infant formula that are included in the diet. But also solid foods are necessary for practice with eating from a spoon. And this is important not only for nutrition and getting in a few of those essential minerals, but also for developmental skills. So often this transition can cause constipation. So we definitely like to make sure that the patients are talking about this with their care providers if that is a prolonged issue. Monitoring growth at this stage is definitely going to occur and necessary to be monitored regularly at regular intervals, typically weekly at first and then monthly and more often if necessary. The goal here, of course, is adequate weight gain, but proportionality, though, too, for what the child's length is key. So some infants might be at risk then for growth failure potentially, or be determined to be failure to thrive, based on the CDC or WHO growth charts that are being looked at. So this can often cause great concern for families, and sometimes it can lay a foundation for prolonged concern with eating and growing that might persist through subsequent developmental stages. And this can occur even when we have catch-up growth occurring. And when we say that we're achieving adequate growth, getting those infants to more like the 50th percentile for height for weight or positive BMI Z-scores. So taking all that into consideration as we're looking through this stage. Adding in some textures here, of course, might be challenging too in that first year of life. And so as the care team, we're paying attention to what foods are being accepted, especially if Chiari malformation is present. That may add an additional layer of feeding challenges. So it's important to be discussing these progressions with food with your care team to determine if more advanced feeding therapy would be necessary or helpful. So oral motor skills are being developed along with adequate attainment of energy and protein needs for growth. On the next slide, the infant then transitions into toddlerhood. So it's important to have a division of responsibility, we say, and we quote Ellen Satter principles here when we talk about the division of the parents having the decision of what and when to offer these foods, and then allowing the child to decide what they will eat and then how much. So here, offering foods from all food groups is key. And then that will help create a less stressful eating environment and set a more positive tone around meal times. So with that in mind, it's important to have a goal of offering a variety of foods and then allowing the child to accept the foods, not just by eating them, but taking them in through all their senses. So allowing them to just tolerate seeing the foods, smelling the foods, and hopefully eventually tasting and then eating the foods to help then expand the diet and diet choices. We recommend setting a schedule for eating. So the goal would be to offer 3 meals and 2 snacks about every 2.5 to 3 hours. And this will allow the toddler to cue into hunger and avoid the grazing. This can be done with, again, the 3 set meals, at least 2 snacks, maybe 3 snacks, depending on how the day is. At those eating occasions, it's important to be intentional then about offering a grain food, a protein source, and then a fruit or vegetable. It's also important then to have that fortified beverage there. Usually it's a whole cow's milk with that calcium and vitamin D source. One food can be a food that is normally accepted, but sometimes it's important to then offer new foods so you can help the child expand the diet and add more foods accepted in their repertoire of foods that will be consumed. Encouraging parents to also eat with the child, model those healthy behaviors is really a key piece for toddlers to learn, then to be able to trust the foods that are in front of them, and then have confidence in eating as well to expand on those tastes and textures. We know food jags typically occur and they're normal. Sometimes, though, there could be a signal that growth might be slowing down at certain periods. So it's important then to still monitor growth, of course, and then go through these reports with care team. And then to note that if it's prolonged, we want to make sure that there is still adequate intake occurring, because this stage is so important for brain development that we want to make sure that we have adequate intake there as well. And then, of course, maintaining that adequate calcium and vitamin D through that milk or milk fortified beverage that's present in the diet to help with the bone development at this time. And if those foods are limited or omitted, it's really important to have assistance with determining how you're going to go about getting those minerals and vitamins in the diet in an alternative way. On the next slide, we talk about nutrition for the school-age child. So at this juncture, we're seeing a lot of changes nutrition-wise. Here we tend to see a little bit more slower growth, but yet we have a bump up in what the vitamin mineral needs are. So sometimes that can be tricky to get in and get that balance in. And so here is a good time to start discussing with your care team and having the care team implement strategies to have weight management plans in place preventatively, just as part of a normal healthy lifestyle, to not then think about it later, but again, kind of thinking about ways to do that. So choose your beverages wisely. The goal, of course, is to get in enough fluid, and later on in a few slides, we'll talk about what that means and how to calculate what that actual fluid amount might look like. It's always important to limit juice. A study just recently was published this past month looking at consumption of juice and how that directly relates to overweightness and obesity potential. So getting in juice can be sometimes of a different treat or alternative there, but keeping that in a smaller amount is key to help keep the over-calorie consumption there more limited. Sometimes that juice amount can make someone feel thirstier, so we tend to overconsume that. So again, limits there on the juice. We really want the fruits and vegetables in the diet to help provide fiber, and that can definitely be void in juices. Getting in adequate vitamins and minerals, as we've already highlighted, is really key at this stage too, since there's a little bit more of a bump. And so definitely, if there are any foods or food groups that are being omitted, it's important to get those minerals from an alternative source. So knowing what that option might be for you or for the child is definitely important. Keeping those fiber-friendly foods in the diet and having that exposure early on is a really helpful way to go about combating constipation. So a variety of fruits and vegetables, and we'll have some other slides that kind of highlight how to incorporate fruits and vegetables to make them really half of your servings, half of your plate. Essentially, every time we have meals and snacks is really something else to think about. The majority of our population do not meet the recommended fruit and vegetable goals. So really still emphasizing different ways to get that in the diet in different forms, whether it's cooked, whether it's, even some versions of small cut up grapes, maybe in a frozen form or some alternative there is important to keep trialing to see what might be accepted. And then, of course, adding in whole grains, nuts, seeds, and legumes for alternatives for fiber as well. On the next slide, we go through nutrition for adolescents. So here, lots of changes are happening in the adolescent world with some growth spurts, but typically we're seeing lower energy expenditures. So with lower energy expenditures, as we saw in the previous talk, learning then to keep that balance there of what energy is coming in, knowing here at this point in this stage, we have a little bit more of a lower energy expenditure, but knowing that we still need adequate nutrients present with that moderation. So the emphasis there is to continue to focus on foods to keep in the diet. Get these foods first. Our fruits, vegetable servings, whole grains, adequate protein sources, and we'll talk a little bit more about what that might look like. Getting in, again, the adequate vitamins and minerals. So getting that variety there in the diet is necessary to achieve those goals. And the emphasis on foods to, again, incorporate in the diet is important for a healthy relationship with eating. And then getting involved in food preparation. As we'll see very soon, that eating responsibility will shift. So having that adolescent involved with preparation, whether it's even making a grocery list, taking those shopping trips, having a garden, learning more about food. There's a variety of ways to expose one to food and food in the diet for eating and health. And that might help get somebody then to that transfer of responsibility for eating. As we move into the next slide, and for nutrition for the teens and young adults, there's a noticeable shift on that responsibility of eating. Here is when there's a lot more of choice being made by the teen or the young adult. And the goal again here is still to make a couple of key choices, especially when it's related to smart snacking. We want to make sure that there's still that variety there, but we want to know that all foods can still fit, and there's ways to still snack and have those other foods, but maybe learning how to pair them with adequate protein sources is helpful at this point. So for example, if we want to have chips, is there a way then we can pair it with a protein source, maybe like a hummus that gives you then a little bit more variety of fiber, protein, and that feeling of fullness when you're having that meal versus just loading up in one food group, for example. Getting an adequate protein is essential for many reasons, but learning what those food sources are, so whether it's coming from a meat source, a vegetable source, from the legumes or the bean group, is really a helpful tool. And then how much protein? So we'll go through that a little bit more specifically, but taking your weight in pounds and roughly around half of that amount, or knowing what your weight in kilos is and slightly less than that number, is about the amount of adequate protein one would need in a day. And then from there, breaking that down into 3 meals is helpful to spread out the protein. So you're getting a balance at each eating occasion with then a little bit left for snacking. That helps give you a more balanced approach to eating, helps sustain your blood sugar levels, and then give you a better feeling of fullness. The same there with adding in those fruits and vegetables to help round out the diet, again, for the vitamins and minerals that are essential, but as well as the fiber. Finally, having in those milk beverage sources is necessary to achieve adequate calcium and vitamin D. and then the non-calorie water or other non-calorie beverages to help fulfill the fluid requirements there is necessary, as well, as we'll talk about in a couple more slides. We'll move on then to the adult nutrition, and having a plan for lifelong health is at the crux of what message that we're trying to send today. You can visit myplate.gov for specific guidelines, and then you can actually go in and get the right plan for you. You can enter in your specific data related to your height, your weight, and your activity level to identify what amounts of these food groups you need. And that will help give you a starting point. And I would encourage you then to look at that at each meal and perhaps measuring out and equating to what those cup suggestions might be. For example, for your fruits or vegetables, would be helpful to learn and get an idea of the portion sizes. As we talked about earlier, we have a little bit more of a distortion of portion sizes in society in some aspects. And so getting an idea of what actually a half a cup or a cup looks like will help with that planning as well. And then finally, revisit what those goals are. You might have to take a little bit of time to record what that intake is for a period to see if there's something that maybe has changed in the diet over time. These are just some helpful tools that you can refer back to help you as you move along. On the next slide, we just highlight a couple of key principles here in looking at bowel management moving forward. Really, it's making sure that we have enough hydration in our systems, as well as that balance of the soluble and insoluble fibers. So wanting to know exactly how much fluid is necessary is key there, and looking at it from the approximation of what your body weight might be, and then a calculation of adding an extra fluid as we go along. And some of those principles are really well highlighted in that first article that everyone has received. But for example, if you're a 40 to 50 kilogram weighted person, roughly 8 to 9 cups of fluid is what would be required. Getting an adequate soluble fiber from foods such as beans, and then a balance there with insoluble fibers from foods such as whole grains helps give that water and bulk and soft stool build that helps more with bowel movements. And the recommendations of fiber are listed there based on age. So roughly 25 to 30 plus grams are needed there. So that would be on average of 7 to 10 grams of fiber per meal. So taking a moment to again look at those food labels and see about how much you're getting at a meal might help give you more of an idea if you're meeting those guidelines and goals. Moving on to the next slide, we'll look at wound healing and muscle maintenance. So we've talked a little bit more about the extra needs for protein at times. We want to prevent any type of wounds or openings, and that might require a bump up in some of these nutrients, such as the protein that we've discussed. And that is our calculations that we look at based on body weight, as well as looking at it from getting in enough calories with that balance there with activity. But definitely something to think about here from a practitioner standpoint. Can kind of walk through these calculations with those that have questions about that, as well as adding in sufficient amounts of micronutrients and omega-3 fatty acids there with diet changes there as well in consideration. So for example, making sure that there's a strong presence of fruits and vegetables, and then omega-3 fatty acid foods, considering additions of salmon, fatty foods, and walnuts in particular. Finally, I just wanted to leave with a few more references on the next slide to consider. And these are some tips, so some recipes that we can add for young ones, as well as suggesting that you talk to your care team to discuss more about nutrition with a registered dietitian, and then resources here if that care needs to be found. Thank you so much for your time. We will now turn it over to Dr. Crytzer, who will be discussing physical activity.
So we're going to talk about physical activity, and we want to start by understanding what are the guidelines for all Americans, and these include the guidelines for people with spina bifida. The guidelines recommend that everyone get 150 minutes a week of moderate aerobic physical activity or 75 minutes per week of vigorous activity or a combination of the two of those, as well as at least 2 days a week of muscle strengthening for all your major muscle groups. It's also recommended that if you can't meet these guidelines, to be as active as you can and to avoid sedentary activity if you're not at this level yet. And I'll talk a little bit more about how to ramp up a program from your baseline. It's also helpful to get support from a physical therapist or a certified inclusive fitness trainer, as well as your physiatrist before you start an exercise program. The things that we want to include in a physical activity program would be aerobics, which would be they use your large muscles and you'll be getting your heart rate and your respiratory rate increased, and strength training and stretching. And so I want to briefly touch on physical activity for children and their guidelines. For ages 3 to 5, it's important to encourage daily movement through active play. When a child gets up to the ages of 6 to 17, the requirement is for 60 minutes of moderate to vigorous aerobic activity and 3 days a week of strengthening. And so exercise in the school setting, that also counts towards your energy expenditure and towards these minutes. And so parents can collaborate with the gym teacher. And the other thing is that under the Individuals with Disabilities Education Act, schools are required to provide adaptive fitness to children who qualify. So in other words, if the child has an IEP, then adaptive physical fitness should be provided. And so these are just some examples of amount of physical activity, as I mentioned, that's required, and some different types of physical activity. There's all different types, but things that would increase your strength would be things like tug of war or hitting a large ball, canoeing and paddling, and even body weight strength training. So these are all different types of physical activity, and it's important to find something that the family as a whole, enjoy, that can be done together. So as I mentioned, there's 3 parts of physical activity. There's aerobic, strengthening, and stretching. Stretching is very important to prevent injury, and there's different types of stretching. There's dynamic stretching and there's static stretching. Dynamic stretching, we typically recommend that before you do a physical activity session. So this is large movements of the large muscle groups, and that warms up your joints and your ligaments and tendons and muscles. It also warms up your body. And so this example here is somebody doing arm crosses. So their arms are out and then they're crossing over. So it's a large movement and it can get your heart rate up. The other thing that's recommended is static stretching, but typically we recommend doing this at the end of the physical activity session. And so you could do either a multi-joint stretch or a single joint stretch. A multi-joint stretch is indicated in the image on the left, is when, for example, this person is stretching the muscles around their shoulder, around their elbow, and around their wrist, whereas a single joint stretch, the image indicates that the person is stretching only their wrist extensor muscles. And so that's the kind of thing that you want to do at the end of the session after you're already warmed up. And typically we recommend that you hold these stretches for at least 30 seconds. There's also various types of strength training, and some of these, especially body weight strength training, you don't need any type of equipment. You're just doing it with your own body. So the example that I have here in the image is showing somebody doing a bent knee push-up. The other thing that people sometimes like to do is resistance bands, because you can carry these with you when you travel. They're easy and small, and they can provide a nice program for strengthening. Barbells and machines are also other options. And importantly, we want to include aerobic activity. So these are activities like football, basketball, swimming. These are all activities that are going to increase our heart rate, our respiratory rate, and importantly, as Michele had mentioned, they're going to increase energy expenditure. How do we know if the guidelines say that we should exercise at a moderate intensity level, how do we know that we're exercising at a moderate intensity? One of the ways that we measure this is by using a rating of perceived exertion scale. There's two scales pictured here. One is the wheel rating of perceived exertion scale, and one is the Borg scale. The wheel scale was validated in people with spina bifida who were doing a graded exercise stress test. And the Borg scale has been used for a number of years and can also be used. It's a very simple scale. It goes from 1 to 10. And as you can see on that scale, a moderate range would be a 4, 5, or 6. And that number correlates typically with your heart rate. So if you're at a 4, you multiply it and it should be around 140. So you're exercising at more of a moderate range. And so these scales can be helpful if you have a small version that you could take with you. Or the other way that you can monitor your level of intensity is that you can use the talk test. So, if you're able to talk while you're exercising, that's more of a moderate intensity. But if you get to the point where you can't, sing a song when you're exercising, you're more into the vigorous range. So there's various ways to monitor how exerted you are and whether you're reaching up into that moderate range. Importantly, we want to make sure that we're preventing injury when we're exercising. So as I mentioned, stretching is a very important component. We also want to listen to our body. Many people have delayed onset muscle soreness that may set in, and that just means you worked your muscles, and so they may feel sore in general. But if you have severe pain in a joint, then you want to see your physician. We also recommend slowly ramping up to meet the physical activity guidelines. So you're not going to start at that 150 minutes a week. It's okay that you're not there. You start slow and you build up, and I'll tell you how to do that. I'll give you an example. The other thing is to work with healthcare professionals. If you have a prior injury, for example, if you injured your shoulder in the past, before you start an exercise program, you can meet with a physical medicine and rehab doctor or a physiatrist and a PT or an OT to work on improving the strength and range of motion around that joint before you start an exercise program. And for example, physical therapists can help you to establish an exercise program that then you can carry over into a community-based fitness center like a gym. Additionally, it's very important that you set yourself up for success. So you want to make sure that you or your child's wheelchair fits well, provides adequate pressure relief, that the arm position in relation to the wheel and propulsion is fitting properly, is set up properly for efficient propulsion. And to do this, you'll want to work with a physical or occupational therapist who is an assistive technology provider and your physiatrist, and they can collaborate to ensure that the fit of the wheelchair is set before you start a physical activity program. So how do you develop a physical activity program? Well, there's a number of things that are listed here on the slide, and writing a goal is something that both JoAnne and Michele mentioned behavioral change. Writing goals are part of behavior change. So we oftentimes write a SMART goal, and I'll give you an example of that. And that's something that's specific, measurable, achievable, relevant, and time-based. And when we write that SMART goal for physical activity, we can apply the FIT principle, which stands for frequency, intensity, time, and type. And those are the parameters by which we can measure whether that goal is being met. We also want to start low and go slow. Again, listen to our body. Try to avoid the weekend warrior syndrome when we do all the exercise on the weekend, and really take the time to find activities that you and your child, you and your family enjoy, and working out with a buddy is also recommended. Also, decreasing sedentary behaviors is important. There's been more and more research studies in this area, finding that reducing the time that you spend in sedentary activities, which means you're sitting, at a monitor all day at your work, for example, that would be an example of sedentary behavior. But start thinking about what can you do to increase activity throughout your day. So taking breaks every hour for 5 minutes and, wheeling or walking around and moving intermittently, that's going to increase that overall energy expenditure throughout the day. And that's on top of, planning some planned exercise or physical activity sessions. So we want to talk about what is a SMART goal? And as I mentioned, it's a goal that you write that's specific, measurable, achievable, relevant, and time-based. This is an example of a SMART goal. In 4 weeks, I'll push my wheelchair from my dormitory to my class that's across campus 5 minutes faster than my baseline time of 20 minutes. And so looking at this chart here, what I want you to see is that this is an application of the FIT principle to the SMART goal that we wrote. So on the left-hand side, you see frequency, intensity, time, and type. And across the top, you see there's a baseline where that person is at baseline with these measures and weeks 1 through 4. At baseline, this person, what they're doing for physical activity is look at the type, they're propelling their wheelchair on a level surface. They're doing that for 20 minutes at light intensity 4 times a week. Now, week 1, they're only going to change one parameter. So the important thing here is that you're only changing one variable per week. So at week 1, the only thing that they're changing is the number of days that they're doing their propulsion. So at week 1, they ramp it up to 5 days a week. During week 2, the number of times a week stay the same, but they've changed the intensity level. And if you look at the type, what they've done is they've added hills in. So that can increase your heart rate, that increases the power that you need and the energy that you need. And so your intensity goes up. And so they've kept all their parameters the same except for the moderate intensity. Week 3, the person has increased their minutes. So they're going from 20 to 25 minutes. And then in week 4, they're decided to keep all the other parameters the same, except for now they're ramping up to include moderate to vigorous intensity activities. So adding more hills into that program that they have. So you can see how overall this FIT principle can apply to your SMART goals when you're writing them to make them more measurable and time-based. These are some resources. The My Wheelchair Guide that's listed there provides you with information on wheelchair fit, wheelchair maintenance, and how to get through the wheelchair service delivery process. And that's on the United Spinal website. Also, the physical activity guidelines are listed there. And the National Center for Health, Physical Activity, and Disability is a really nice resource where you can find videos and more information about physical activity. And we will provide you with a separate PDF of a list of funding resources, things like Challenged Athletes Foundation that you can write to obtain adaptive sports equipment such as a hand cycle or wheelchair basketball chair. And then the next 2 slides provide you with various resources on adaptive recreation and fitness. And this is the final slide that includes additional information on adaptive fitness. And one thing I wanted to point out is the Discover Accessible Fitness. That's on the NCHPAD website. That's really good if you're going to work out in a gym and use machines. It really tells you and highlights nicely the balance that you need to use and exercise when you're using the fitness equipment. Thank you very much for listening, and I'd like to turn it over to Jen Tudor, and she's going to talk about research.
Thank you so much to SBA for the opportunity to share a little bit about the research that we are conducting. And it's worth noting that this research project that I am going to tell you about today is a direct result out of the participation from the various SBA chapters and other members of the community. And this is the research that you actually asked for, and so we are conducting it. So let's go to the first slide and let me show you what we did. So my research lab is actually focused on the neurobiology of cognition, as well as a little bit related to metabolism. And so I got involved with the SBA specifically because I am an adult with spina bifida. So obviously, a lot of these concerns is deep to my heart. And so my research lab, although we work on metabolism and we work on neurobiology, I really asked 2 of my students, whom you see here, Erin Klein and Alexa Lenditsky, and I asked them, please help us with this project that we really needed to hear from the community. And so what we decided to do is, as Dr. Polfuss said in the beginning of our session today, there's just not a lot of spina bifida specific research. So taking advantage of the World Congress, where so many health providers that are specific and interested in spina bifida were going to gather, we wanted to survey these health providers and say, what do you even know about weight management and how to offer resources and help to them? And so you can see from our respondents, about half of them were physicians and the other half were all sorts of other healthcare providers. What was interesting and what you don't really see in this slide currently is that about only half, about 45% of our respondents actually participated in a weight management training session. And so we found that interesting, one. And two, more than half, about 57% of our participants also classified themselves as overweight and obese, which we found interesting and maybe potentially affected how they interact with their patients who would be thinking about these issues. And so if we go to the next slide, you can also see where we got our participation. And what was really nice about the survey is that we really was able to capture from like across the country various providers, which we were really thrilled and excited about. So in the next slide, you would see a little bit of preliminary results. I asked you to take it with a grain of salt, but I wanted to share this with you just so that you can see what we're dealing with here. And so I want to highlight the top 3 lines where they say, does the healthcare provider feel like they have proper training to provide exercise programs for people with spina bifida? And you'd see that the majority disagree with that. Along with that, they feel they have time in their meetings with their patients related to offering guidance. They also disagreed with that statement and whether they have the proper training. And so, as you can see, it's difficult for our healthcare providers to hit everything, but clearly this was a concern for the community that, it is the community that said we care about weight management. But you'll notice that maybe at least the providers that we sampled, they weren't really sure, or a majority of them stated that they wanted more information. And so if we go to the next slide, one of the interesting things is when we then ask the question of how confident are you in providing care, you'll notice that the confidence is actually quite high to provide care for patients that are younger than 18, as opposed to once we get to the adult ages and plus, so essentially after the ages of what we would call transition, there's the confidence decreases. And I think that's part of spina bifida being a childhood disorder, but obviously we don't graduate out of not having spina bifida. So it is something that we need to tackle. So I do not share these preliminary results to being like, oh, this is, a terrible state of the situation. That is not the point. What I want to share with you is often one of the other big metrics that we got back from the survey is most of the providers talk about obesity and weight management on an as needed basis. And what I wanted to convey, especially as a fellow spina bifida patient, is that, I joke when I was in college, I could eat anything and I would just be able to deal with it. I could eat Tupperware and I'd be fine, and when I was younger, I did a whole lot of activity. I was part of a wheelchair basketball team, et cetera, et cetera. And as I became a scientist, I spent much more time in front of a computer. And so because of all of these things that we talked about related to nutrition and physical activity and these concerns, ultimately, the longer lasting question or the primary question for my life has been, what is going to help me maintain the highest level of function for the longest period of time? And that's essentially what we're trying to get here. And I know that many, many providers, healthcare providers, that is also their goal, but they might not necessarily talk about weight management until it's on an as needed basis. And so we need to know more about what's happening within the community. And this is where I'm going to do a shameless plug for our very next experiment that is coming up. We are working on starting to distribute a survey related to attitudes related to weight management and obesity. And this is going to go out to adults with spina bifida so that, for example, we asked a lot of questions about the providers as to what they think it limits the ability for a spina bifida patient to do the things necessary to manage their weight. But we want to know, does that match with the community's view of what actually prevents them or helps them related to weight management? So we are going to ask for a lot of participation from the community, and we hope that you will join us in that endeavor. So again, I wanted to thank SBA for allowing me to share some of these results, and I'm going to turn it back to Dr. Polfuss.
Thank you for everyone. I know we're a little bit over on time. We're going to just finish up with our takeaways. As a reminder of some high point summaries, one size does not fit all. We understand that. SMART goals are very important. Small, consistent changes are really going to help you in the long run. Beware of fads or something that is too good to be true. Connect with your healthcare provider, ask for help, advocate for more research that is specific to spina bifida. We need your help in doing that. And then when the research is there, please participate. Your voice is so important. And then finally, please submit questions and attend our question and answer sessions that are coming up in February. And that is it. So thank you.